The World Health Organization now classifies gaming disorder and addiction to playing video games as a real mental health condition. Medical professionals are also starting to realize that in the modern age, behavioral addictions can turn seemingly harmless things like video games into something quite dangerous. Lecturer of psychology at Makerere University, Dr. Paul Nyende, says this could have long-term effects on behavioral change, especially among children.
Getting a child absorbed in the virtual world 100% is unhealthy. It is important that you have the child an opportunity to interact with the people and come back into the real world. Definitely they have impact on your physical health and impact on your adjustment, growth and psychological functioning as a child. You can have visual problems. You can also have postural problems, that is the way you sit.
Oh, another big strike!
Most of us understand how alcoholism and drug addiction can cause pain and suffering. Craving a cigarette or a stiff drink on occasion is one thing, but addiction forces an individual to behave in an unusual and in often destructive ways in the service of finding the next fix. But you can also become addicted to activities like gaming. Dr. Nyende says some games are too violent or contain explicit content that if not monitored, people addicted to gaming will most likely want to act out what they play on screen.
If you start to drive the computer games, you are hostile because you're competing and you know you're not going to die. So you hit the walls, you push other cars out of the way, and you gun down the street like a madman. But when it comes to real driving, any slight error can mean death. Children are so much embedded in guns that you worry that if this child gets access to a gun, he already knows how to use it, and he can be very lethal.
Dr. Nyende says video gaming arrests the players in a virtual world, and this affects their levels of socialization.
It will impact psychological development and also generate psychological problems. Stress is one of those. Depression, especially when you are getting to hard levels that can be very difficult to crack, you get very frustrated and you can get very depressed. They often would lead to isolation.
According to the World Health Organization, the inclusion of gaming disorder as an emerging health problem follows the development of treatment programs for people with health conditions identical to those characteristics of gaming disorder. Video games can be an effective learning tool, and they can also just be fun. Fun is important. No one wants to take away your fun.
They can help you think fast, help you learn to solve problems, give you a sense of accomplishment when you move from one stage to the other.
The World Health Organization also identifies some characteristics of gaming disorders, including impaired control over the onset, frequency, intensity, duration, termination, or context of gaming. Increasing priority given to gaming to the extent that gaming takes precedence over the other life interests and daily activities. The continuation or escalation of gaming despite the occurrence of negative consequences. Dr. Nyende warns that you must regulate the time children spend while playing video games to prevent addictions.
Typically, because you're trying to escape the real world, you miss out on practicing out social skills with others. For example, communication skills may not be very well developed. We need to censor the games that are being played, so we should see to it that the games don't have extreme violence and explicit adult scenes. We should also see to it that we limit time for play.
In 2013, it appeared that the internet gaming disorder was most common in males between the ages of 12 and 20, and that the affliction was more prevalent in Asian countries than in North America and Europe. Experts estimated that close to 10% of kids in China and 1 to 2% of kids and teens in the United States were affected. A more recent study underscores that gaming addiction is probably a worldwide phenomenon, albeit an uncommon one. Walter Mwesije, NTV.